day everyone. I am Savian Rainfermil from BSN 1A and today I am going to perform the assessment of breast and axillae. My equipments needed are gloves and alcohol. The first thing to do in assessing a client is of course to sanitize our hands to prevent nosocomial infection. Then provide privacy for the client, close the doors, close the curtains, and ask the client if he is comfortable with his space. And then, of course, do not forget to introduce yourself to the client. Sir, I am Savian, your nurse for today. May I know your name, your age, and your birth date?
Richard De Leon, 24, September 7, 1997.
Okay, sir. How would you like me to call you?
Richard.
Richard. Okay, Sir Richard. Thank you very much. Next is do not forget to ask the client for consent. Sir, is it okay for you to remove your clothes later? And is it also okay for you to touch your specific body parts later for the assessment?
Yes.
Thank you, sir. The next step is I am going to collect the subjective data in which I am going to ask the client some questions with regards to his past health history or present health history, family history, and lifestyle and health practices. So, sir, I am going to ask you some questions with regards to your health. Is it okay for you to answer honestly?
Yes.
Okay, you can cooperate with me by answering my questions honestly. Thank you very much, sir. Okay, Sir Richard, I am now going to start in asking you some questions. Sir, have you noticed any lumps or swelling in your breast?
No.
No. Okay, sir, how about on your underarm?
No.
How about any redness, rashes, inflammation, or dimpling or warmth of in your axillary area?
No.
None so far. Okay, so I asked those 3 questions with regards to the client's breast assessment because the swelling, inflammation, redness, lumps on the breast part of the body is associated in breast cancer, inflammation, infection, and fibrocystic breast cancer. Okay, Sir Richard, do you experience any pain with regards to your breast area? No. If the client answered yes, we should assess or ask the client the cold spa or the current location of the pain, the character of the pain, the onset, the location, the duration, the severity, and affecting factors of the pain. It is important for us to assess or to know the proper intervention on the client. Sir Richard, now let's move on to your personal health history. Have you ever have any breast disease?
No.
Okay, so I asked the client if he ever had experienced any breast disease because it may be related to the current problem the client is experiencing right now. If ever he has a problem with regards to his breast. Sir Richard, now let's move on to your family health history. Sir, do you have any member of your family that has a breast cancer?
My mom.
Your mom has a breast cancer, okay, sir? Do you take any pills or hormonal pills with regards to your breast?
No.
How about, do you work in area which is you are exposed to benzene as an asbestos chemical?
No.
Do you smoke?
No.
No. Do you take alcohol or do you drink alcohol?
Occasionally.
Occasionally. Thank you, sir. So, I asked the client his family history and lifestyle health practices because drinking alcohol, caffeine, taking tobacco is related or associated in having breast cancer. And if the client has a family member with the history of breast cancer, it may also be related to the client's health or he is having a high risk in having breast cancer. After collecting all the important subjective data, I am now going to proceed in collecting the objective data in which I am going to perform the physical examination or physical assessment to the client. So I am going to ask the client if it is okay for him and if he is comfortable in this space to remove his clothes. So sir, are you okay to remove your clothes for your breast assessment? Are you comfortable?
Yes.
Okay, sir. Thank you very much. Since I am going to touch the client's specific body part, I am now going to sanitize my hands using my alcohol and wear my gloves. And I am now wearing my gloves. I am going to start the physical assessment. So, sir, is it okay for you? Are you comfortable with your sitting position? Okay, so I'm now going to inspect the client's breast for symmetry, contour, and shape. So, sir, is it okay for you? So, I'm going to inspect your breast. Okay, so upon inspecting the breast of the clients, is it symmetry? There is no signs of lumps, redness, or any rashes, and the shape is normal. There is no signs of any swollen breast or anything, or there is no sign of edema, and his shape or contour is related or associated with his body complexion, so there is no sign of abnormalities. Now I am going to emphasize some retraction or retraction by having the client to. Sir, can you raise your two hands above your head? Okay, sir, how about pushing your two hands while flexing your elbow? Thank you, sir. How about putting your two hands on your hips and push it forward a little bit? Okay, thank you very much, sir. So upon inspecting the clients or emphasizing client's retraction, there is no sign of any abnormalities. The client's breast is symmetrical and it is symmetrical, and there is no signs of any abnormalities. The client's breast rise symmetrically while he is raising his hands, and there is no signs of any retraction or dimpling. Now I am going to inspect the client's areola. So, sir, is it okay for you to touch your breast? Okay, so upon inspecting the client's areola, its size, shape, contour, symmetry, there is no sign of any abnormalities. The client's areola is related or associated with his skin tone. He has a dark brown areolas, and there is no sign of any redness or swelling. So it is important to inspect the client's areola because orange skin is related to carcinoma, and any scaly or redness in the client's areola is associated with Paget disease. Next is I am going to inspect the client's nipples. So, sir, I'm going to inspect your nipples. Okay, so upon inspecting the client's nipples, there is no sign of any discoloration, and it is usually, or the normal result of the client's nipple is it is bilateral, or they have the same location in his breast. Next step is I am now going to palpate the client's axillary, subclavicular, and supraclavicular lymph nodes. So, sir, I'm going to touch your hands. So, I'm going to check for some lymph nodes in supraclavicular and on your axillary area. Sir, do you feel any pain while palpating your this part of your body? Okay, on the other hand, sir. Sir, do you feel any pain? Okay, sir, thank you very much. So, in palpating the axillary, subclavicular, and supraclavicular node, there should be no signs of any pain or redness or swelling on the part of the client's body. Now, I am going to palpate the breast or the nipples for any masses, temperature, and any tenderness. So, sir, I'm going to touch your breast. Sir, do you feel any pain? Okay. How about this one, sir? Do you feel any pain? Okay, so upon palpating the client's breast, nipples, and his part of the areola, there is no sign of any pain and redness or swelling. There is no sign of infection, and there is no sign of any tenderness or abnormalities. The last is I am going to check the client's nipples or compress the client's nipples to check for any discharge. Sir, I'm going to compress my hands. Do you feel any pain, sir? How about this one, sir? Do you feel any pain? Do you feel any pain, sir? Okay, thank you very much, sir. So, upon inspecting or palpating the client's nipples, there's no sign of any discharge and abnormalities. Do not forget to teach the client the technique on breast self-examination. After collecting all the subjective data and objective data, I am now going to document the client's our findings. So, sir, with regards to your health concern about your breast, there is no any signs of abnormalities. I see no problem. Expect for your mom has a history of breast cancer. Sir, if you feel any pain or if you're uncomfortable with regards to your breast, please do not hesitate to call our clinic or to ask some questions. Sir, do you have any questions with regard to your assessment?
None.
None so far. That would be all. Thank you very much, sir. That would be all. Thank you.